Topic of the day, fillers, different kind of fillers, what happens to them over the years, and what do the different fillers do when they're under your skin? This girl was very, very sweet and very pretty and had bumps, really, really thick bumps. So I had really thick bumps on each side of the eye over here, ridges, kind of ropey. And she had gone to a doctor around here, came to me to figure out what was going on because dissolver wasn't working. And she thought that the filler problem came from the past year or so when she had done some Restylane under the eye and that it moved. That was the assumption. Before she continued, I said, wait, have you ever had permanent filler? This had a different appearance too. So have you ever had permanent filler? She said, no, I don't think so. I said, have you ever had any kind of weird filler? And I asked that because a lot of people don't know what they're getting injected with. And she said, yes, there's a doctor who injected me here, maybe had some mixed stuff in it. She named the treatment. I said, oh, okay. Well, it had Radiesse in there. Radiesse is calcium hydroxyapatite. What it is it's a bony paste or a bony creamy paste that can be injected as a filler. Typically, most surgeons or injectors, nurses would inject it on the bone, kind of deep in the areas on the bone because it's similar to a bony mineral. So if it sits on your periosteum, it doesn't really cause a problem. What you don't want to do is inject it under the skin. So what happens when you inject calcium hydroxyapatite under the skin is that it starts to form rigid granulation formations or crystallization. So you get little rocks or calcifications of the bony mineral and the calcium, or you can get a granulomatous reaction around it, meaning you get scar tissue formation around it and it can thicken the area pretty substantially. The reason people do that is because, or they mix it with other things, because they think it forms collagen. They think, again, that collagen is good. And I'll tell you, in these situations, collagen's not good. It's scar tissue. And unless you are knowingly going to form scar tissue to volumize the face, I wouldn't do it superficially or things like that. So if somebody says to you, we're doing microscopic or dilute or small amounts of calcium hydroxyapatite or Radiesse to form collagen in your skin, you can tell them, well, Ben told me that you're actually just trying to piss off my skin to form scar tissue. Is that correct? If they say no, they don't know what they're talking about. If they say yes, but we're doing it knowingly, trying to form scar tissue because you're gaunt or something like that, instead of Sculptra, you can have a conversation about it. But Radiesse, the problem with it is when you inject it superficially in the skin, it can cause this stuff. And then what do you do with it? Because over time, it's not going to go away fully. On most people, some of it stays. You inject this much of it might stay, but that much is going to piss off the area and form ridges and bumps and lumps and things like that. But what can you do about it? It's a calcium mineral. How do you get rid of calcium? There's no good way. Calcium minerals you might be able to break up with sodium thiosulfate, which is a medication that we use for kidney calcinosis, for renal calcinosis, hypercalcinosis. There are some doctors who can go and inject it to try to break up the crystals with acidification, but that doesn't always work. What happens if you put a dissolver in it? Dissolver might get rid of some of the water that's in the scar tissue, but that's about it. Maybe breaks it up a little tiny bit if there's any hyaluronic in there. And then you can inject 5-FU, 5-fluorouracil. 5-fluorouracil is a chemotherapy medication that we use off-label to break up scar tissue, to cuts down DNA synthesis and decreases scar tissue formation in hypertrophic or thickened and contracted scars. So that's what I injected in this girl today, putting in 5-FU with a little bit of dissolver. What happens if it's injected under your eye though? If you put Radiesse in the under eye in any form, even the tiniest bit, even if you mix it with hyaluronic acid, it can cause a permanent deformity and permanent discoloration in the eye. So when I walked in the room and I saw her, the first thing I thought was, ooh, she's got discoloration in the under eye and something's going on there. It's not a normal filler under the eye. Over time, in the under eye, it typically does not go away. It stays calcified and ends up causing permanent discoloration in the under eye. What happens to other fillers over the years is another question. Hyaluronic acid fillers like Restylane, Voluma, Volure, Volbella, Restylane, Define, Refine, all of them, you may inject it in the face. You can't assume that it's going to stay like that forever. Your body tries to metabolize it, and in doing so, sometimes eats it up, sometimes just denatures it, and then it can form different cross-linking. It becomes a different kind of hyaluronic acid. Those kind of fillers can change their character over the years. They might go from one that's benign and doesn't cause any migration or edema to one that does migrate a little and cause edema. One of those things is Restylane. Even Restylane can do that if it lasts a long time in the under eye. Even though it's the best one for the under eye, it might come to the surface and cause problems. So fillers do change over time and they cause other issues, and they're not the original filler 10 years later. Silicone is not the same 10 years later in what it's doing. The first year or two that it's in there, it doesn't do anything. It just sits there and is pretty indolent and benign. But after 4 or 5 years, your body starts to try to eat it up and it realizes it can. So it forms this inflammatory reaction or granulomatous reaction around it and forms a yellowish bed of scar tissue. So even though you injected this much silicone, later you can have this much scar tissue. So it can grow over time. Fat injections can do the same thing. So fat injections are typically considered benign because it's your own tissue. But if you take fat from here and put it up here, the body might say, I'm a little irritated with it. And it can actually grow over time, not from hormones, not from anything else, just from irritation and granulation formation. You can have fat plus granulation tissue. Alternatively, you can have hormonal changes or weight gain and the fat can grow. Never assume that injectables stay the same over years. They can change. You take that into account into your equation when you're thinking about how do I treat a face. It doesn't mean you don't do it. It just means you take it into account. You say every time if I inject this person, I'm going to assume that some of it's not going to go away. So next time they come back to you, you feel their under eye and you say, oh, I'm not feeling the bone as much this time, but I can inject a little bit. They come back a year later and you touch it and you say, you know what? I don't feel the bone at all. I'm not going to inject you. But they say you haven't done it for a year. And you tell them there's no way I can improve you at this point without making you worse. So there is a limit to what you do with fillers over time. The need for it typically becomes less and less. So people do reach a cap. Unless they're a super metabolizer and they get rid of everything every time, which is highly unlikely, most patients will reach a cap. At some point over a year, 2 years, 3 years, 4 years, there's a point where you cannot improve them anymore with filler. They're holding onto the filler and the shadows they're forming are not going to go away with filler anymore, and it just gets worse over time. The other thing that happens is patients come in and they say, doctor, why can't I smile? What happened to my smile? What's changed over time? And I look at their face and I explain to them that the reason for the smile changing over time can be from fillers in the lips, but it can also be from fillers in the under eye to the cheek. And the most common I actually see is those two, which is patients who are overfilled in the lateral cheek or have really irritating types of fillers, whether it's silicone, Ellafill, Artefill, or just too much voluma, too much Radiesse, or Radiesse that's placed in the muscle. That's really bad. Those things inhibit the muscle contraction of what we call the zygomaticus complex, zygomaticus minor, zygomaticus major. They cross all the way from here over the zygoma down towards the nasolabial fold. Anywhere along that path, if you have too much swelling around it, the muscle's not going to contract properly. The muscle is this thin. The zygomaticus muscle is maximum about 2 millimeters thick. It's a very, very thin muscle, and it traverses all the way over here. It's 2 millimeters thin over here. Over here, it gets a little bit thicker because it overlaps and it has a little more thickness to it. But it's a very thin muscle, and putting filler around it can inhibit its motion. So you do have to be cautious how much filler you put. If you put it deep, it's less likely to intervene. If you have it deep and superficial, it's more likely to intervene. Those patients lose their smile over time, and when they smile, their mouth doesn't go up anymore. The other thing is it bunches up around the eye and it crowds their eye and makes it look deep. So adding filler over time can definitely change your smile. Dissolving it doesn't necessarily reverse that though. If somebody has a clear abundance of filler and they're limited on smile, I dissolve them. I dissolve the shit out of them and I put a ton of it over here, superficial to deep, because I'm not too worried about dissolving the lateral cheek. And I always do that first with a little bit in the under eye before I go here. I don't like dissolving here because it can be harmful. So here and here is pretty easy. Here and here, you can cause some pretty bad deflation. So what I do here and here is I inject them first, dissolve, barely touch this area. I wait about a week or two, and then I see if their smile came back and I see how it moves. And then you can identify if there's filler in here. Otherwise, you can't identify it unless you're using ultrasound and there's big collections in there. We dissolve that, make it come back. The lip, easy thing. The lip, if you have excess filler that migrates above the vermilion, which goes up over here to the philtrum, it's going to cause an inhibition of the orbicularis oris movement. The muscle can't move so well and it's stiff and it just kind of hangs there, which ages somebody more rapidly, which is another reason they can't smile over time. It's not just the collection of filler, it's that their muscle hasn't worked for a long time and it starts to elongate. The orbicularis muscle is a horizontal muscle that comes across your teeth and only works with flexion across the teeth. And if it's got edema in it, it's not going to be able to contract against the teeth and it just starts to hang down over time. You also have levators that can pull it up and can have a problem too, but it's mainly that. Filler in here in excess inhibits motion. If it migrates, it inhibits motion. Which are the ones that migrate? Most fillers, if you inject them on the vermilion border, will immediately go above the vermilion. Dr. Harris calls that spread. I agree with him. That means you injected it there, even though you didn't know it. Most of them won't migrate much from that spot if it goes there. It'll maybe go about 1 to 2 millimeters and that's it, but it can cause edema and lymphatic obstruction. Juvederm and the classic Juvederm XC can travel 10 millimeters. Silicone and silicone scarring can travel 20 millimeters. They can actually go 2 centimeters, so all the way up. It's pretty impressive. So those things do change over time. They can migrate over time. They can change character over time. I'd say to doctors, when you're looking at patients who come in repeatedly, realize that filler is not forever. You don't keep filling people. Unless you've never filled them in a certain spot, fine. But you can't have them come back over and over again and say, I'm gonna keep filling you, it keeps going away. It doesn't. Residue stays, and at some point you reach a cap. So at some point you are gonna get to, a patient who comes in and you say no to them. You say, no, I don't wanna fill you anymore. And they say, why? You do it every time. You say, well, right now I don't see a place I can fill without making you worse. That's about it. For the Radiesse, people who have had Radiesse or are gonna get Radiesse, just realize Radiesse is really safest when it's placed on the bone. It is up to the doctor's artistic discretion, I'd say, to use it, meaning they think it works better on certain areas because it's pasty and it can move around where they want it to move. It does not last longer than Voluma. It does not last longer than Restylane Lift. So if a doctor tells you it's gonna last longer, they're probably mistaken. It does not last longer than the other ones. It's not proven to, it's never been shown to. I don't think most doctors would say it does. If doctors say it goes away, it might, but it might also stay in your soft tissues forever. I would avoid injecting it into the nasolabial fold, never inject it into the lip, never inject it along the zygomaticus muscle, never inject it under the eye. You're very limited on where you want to inject Radiesse, and realize that if you ever hit a blood vessel with it, you can't get rid of it. It does have an additional risk. Still, I used to use Radiesse all the time. Didn't have problems with it. I always stayed on the bone here, stayed on the bone down over here, and put very small amounts and you're fine with it. If you ever need to get rid of Radiesse, good luck. It's going to be very, very difficult. I use those things. I use 5-FU to soften the nodularity. I use dissolver sometimes to make sure there's not another component involved in it. Sodium thiosulfate, again, is experimental. I don't know if it works. It is a backup plan. Overall, if somebody says I want to use micro Radiesse or dilute Radiesse to do collagen formation or make collagen form in your face, please just don't do it. I don't think it's a good idea. It can cause nodularity, calcifications, weird things. We have other things that form collagen in a better way, like radiofrequency treatments. The best in the scarring realm, the most predictable in the realm of scarring formation, which is what it does, is Sculptra. Sculptra is a poly-L-lactic acid, meaning it's a broken down piece of suture material that's an irritant, can form calcifications or little nodules too, but less than Radiesse and is a little less hydrophilic than Radiesse when it causes the swelling. So for people who are trying to really form collagen in the midface by scar tissue formation, and they don't have fat, don't have anything else, and they're gaunt, Sculptra is a better option for that.